Well, let's begin with the big health news breaking overnight. Legislation to establish a framework for a universal Pharmacare system in Canada is now law.
The adoption in the Senate of the Pharmacare bill is an essential first step in making sure that every Canadian everywhere has access to the medication that they need.
That is Health Minister Mark Holland speaking at a briefing earlier this morning. The new law was crafted from intensive negotiations between the Liberal government and NDP, and it means Canadians will have free access to diabetes and birth control medication sometime in the near future. David Thurton joins us now from our Parliamentary Bureau in Ottawa for more on this. So, David, that is a big question, just how long it will be before Canadians will get this access to free drugs.
Yeah, and we don't yet know the answer to that question, when Canadians will get access to those free drugs. So we do know from the health minister, he spoke this morning to reporters that that probably will be soon, but soon is very vague. We still don't know when soon will be. But we do know, because Pharmacare legislation is now the law of the land, Canadians certainly are one step closer to what should and could amount to free medication, starting with diabetes treatments and contraceptives. Like I said, Health Minister Mark Holland says Canadians will get access to those medications soon, but first he has to iron out and ink deals with the provinces and territories because, of course, Jacqueline, the delivery of healthcare in this country is delivered by provinces and territories. So those negotiations are happening. Holland says that he is confident that we will see agreements with some of his provincial counterparts soon. Already we know that there are some eager provinces that have put up their hands already, like the BC NDP government, like the Manitoba NDP government, and some others as well have been excited or open to talking to the federal government about getting Pharmacare in their province, and perhaps the territories are interested as well. But some provinces are not as enthusiastic. Here's what the health minister had to say about that.
Now we're into that second part, more detail-focused nuts and bolts of delivery. And that is, not an easy step. That's obviously a big part of the puzzle. But having sort of those broader conversations and having a broader conversation around sort of shared priorities, that's kind of, with health ministers and with officials, the types of conversations that we've been exploring. Now that pivots now with royal assent to brass tacks.
So you heard from the health minister there saying that, yes, there could be some difficulties. There could be some hard work that's still ahead when it comes to getting these medications into the hands of Canadians so that they don't have to pay with their credit card. What he's speaking about there most likely are provinces like Quebec and Alberta, Jacqueline, who said that what the government is putting on the table, they're not interested because they have their own systems of delivering drugs to people who need coverage or don't have coverage in those provinces, and they're fine and they don't need what the federal government is providing.
Now, David, this bill, it was a key demand of the NDP. Now that it has passed and their deal with the Liberals is no longer in place, is Jagmeet Singh likely to join the Conservatives' push for an election?
Yeah, Jacqueline, you're right to ask that question. It's a question that we asked Holland earlier today. He has said that he has been still having productive conversations with his NDP counterparts, their health critics, and both parties are still focused on delivering for Canadians. But the reality is Jagmeet Singh has said that the deal is done with the Liberals, and they are currently not in negotiations with this government to keep them in power. And quite frankly, an election, he said, is very likely. Even more likely, you have to think, Jacqueline, now that the NDP has gotten something that they have been asking for years. Pharmacare legislation. But the reality is, as well, you have to wonder and know as well that just because we have a Pharmacare law, Jacqueline, doesn't mean Canadians have free medication. And so that certainly is a calculus that the NDP is weighing, because in fact, if a Conservative government is elected and no deals are signed with the provinces and territories, there's no guarantee that a Poilievre government will fulfill the NDP's dream of getting free medication into the hands of Canadians. So like I said, that's a calculus that the NDP will probably have to weigh in the coming weeks and the coming months as they decide whether or not they'll continue to, keep this government alive.
Okay, David, thanks so much. That's David Thurton in Ottawa.